Bismillahirrahmanirrahim. Quote of the day. The strong man is not the good wrestler. The strong man is only the one who controls himself when he is angry. By Prophet Muhammad, peace be upon him. I'm Dr. Muneeb Altaf, and today I'm going to critically appraise the article by considering the strobe checklist. So, starting from the title, this is the checklist, and in the title, it says that indicate the study design with commonly used term, and in the abstract, to provide an informative and balanced summary of what was done and what was found. So, this is the title. It's a role of referral system in the provision of health services to the patients, a prospective study in the South Punjab, Pakistan, and it was published in 2023. Now, in the abstract, in the abstract, a structured summary has been given, and authors say that the rural community are still experiencing a multitude of the health problem in comparison with their urban counterparts. Objective of this study is to identify the challenges influencing implementation of the referral system for quality healthcare services delivery and investigate the role of effective referral system in the Rajanpur, Pakistan. And after the assessment of this study, it was found that there is no implementation of proper rules and regulation of the referral system in health system in district Rajapur, Pakistan. So in the title, study design was mentioned, and it in the abstract it was a good summary, and it was mentioned that what was found, what was done, and what is found by the author in this study. Now comes to the introduction. In the introduction, we will see the background or rationale and objectives. So, in the introduction, variables required in this study is the referral system, income, age, transportation, availability of the doctor, and availability of the medicine, educational background, relevant hospital and diseases. And in the introduction, the author said that this study aims to identify challenges influencing implementation of the referral system for quality healthcare service delivery and investigate the role of effective referral system in Rajasthan. Now, strength of the introduction, a good scientific background was given with almost 10 citation. Aim of the study is clearly mentioned, and considering the weakness, the clear rationale was not given, and any hypothesis is also not provided. Now comes to the methodology. We will see the methodology and the study design, setting participants, variables, data measurement, and study of the bias and statistical methods. So in the methodology, the targeted population were patient approaching for treatment of three specific diseases: tuberculosis, hepatitis, and cardio-related, in the hospital of Rajanpur. And these are the three district level hospital. Uh, these are the three district level hospital where study has been conducted. So DHQ Rajanpur, THQ Rojan, and THQ Jampur. And this was the formula which is used for the sample collection and sample size. Sorry. So, in the methodology, in patient-related questionnaire, respondents were patient referred from different healthcare facilities. So, this part include demographic and socio-economical variables such as household status, education level, area of the patient, general health condition of a patient, from where patient gets their first treatment, and from where patient was referred was also noted, and overall cost of the treatment including direct and indirect treatments such as registration fees, transportation fees, cost, medicine cost, miscellaneous cost was the part of questionnaire. and simple random sampling technique was used for the sample size, and the sample size is 273. And for the data analysis, frequency table were made with SPSS, and Excel was used to generate the graphs. And a pre-structured questionnaire is modified and adapted. And questionnaire was designed to take into account how culture works in the research area, and to make sure it was written in a way that was clear and easy to understand. Now, strength of the methodology. Setting and location is provided, variable was given and explained, how data collection is done by the questionnaire is mentioned, source of data is given, and formula for sample size is given, sample technique is mentioned, and statistical method used for the analysis is mentioned. Now comes to the weakness of the methodology. Relevant dates and period of the recruitment was not given. No specific exclusion criteria is mentioned. No mathematical explanation or calculation of the sample size is given. And no explanation of confounding and missing data is given. And bias is not mentioned or explained. Now comes to the section of result and discussion. In the result, it was evaluated that 103 patient, which is 41.4% of the total sample size, belongs to Rajanpur zone visiting DHQ hospital Rajanpur. 44 patients were from Rojan and 88 patients from the Jampur visiting Tehsil headquarter hospital. Minimum number of respondents, which is 5.6% of the total sample size, was from other nearby district area. And these are the two different graphs showing the results and the percentages of the age of respondent, and specialities of the different respondent. And in this table you can see the prevalence of the disease of that very specific area. So, in this is again the result and discussion, and the education level of the household member analyze the level of awareness and education status of the respondent was categorized as illiterate, primary, middle, matriculation, intermediate, bachelor's, and master. So, in this pie chart, you can see the different levels of education. So, an inadequately working referral system might be incomplete to the fault, and system investigation of the patient referral was directed to the region of Punjab territory to distinguish a real inadequacy, assuming any in this area. So this was the study which was done on the attack of the Pakistan, and a cross-sectional study conducted in the Saudi Arabia attempt to recognize the gap in the exploration on the effectiveness of the referral forms for the patient with the type 2 diabetes in the Saudi Arabia, and show that there was no proper allocation of the doctor to pursue with the referred as well as direct visiting patient, according to their study. Strength of the results and discussion. So, participants are reported beautifully in different stages of group. Characteristic of the participants are explained. Outcomes are explained in percentages, pie charts, and table. And key results are summarized with respect to study objective, and overall interpretation of the result is done with respect to relevant evidences. Now, weakness is the no flow diagram is made, and number of the participants with missing data for each variable of interest is not indicated. No unadjusted estimate are given. Analysis of subgroups and sensitivity analysis is not done. Limitation and bias is not discussed. External validity is not discussed. And source of funding of the research is not mentioned. So this is the stroke checklist. I have tick and crossed all those areas which are given and which are not given. This is the YouTube link. Please like and subscribe, and thank you.
Okay, thank you very much, Dr. Muneeb. I would request Dr. Amber to please comment on it. Please, Dr. Amber, go ahead.
Assalamualaikum, ma'am. Assalamualaikum, everyone. It was a good presentation. The stroke checklist was used, but I would like to add few points for Dr. Muneeb, and then I will give a review. Dr. Muneeb, you said regarding the abstract that it was an structured abstract. Please correct this in your presentation. It was an unstructured abstract as no headings were given. Secondly, you said no sample size calculations and formulas were given. Please correct this as well. The sample size calculation and sampling techniques was mentioned. So, and whenever you are talking about the bias, so try to identify the bias according to the study designs and also mention them along with the in your presentations. Like in this presentation, I would clarify which type of bias would have been addressed. So overall, it was a good article. Starting with the title, it was clear, showing the population and the and the variables to be addressed, and main variable that has to be addressed. Later on in the abstract, it was having in the abstract there was a clear objective statement, and also the aim of the study with variables, and result section was and conclusion was given. In the introduction, yes, the rationale was given, aim of the study was given, but it could be improved in terms of the referral systems and the other barriers that we face in our system. However, it was fine, and a good scientific background was given. But in the methodology sections, there were a few points that should be have been addressed. One was regarding the questionnaire. Um, no reliability coefficient was mentioned. Either Cronbach alpha value was not mentioned. Either pre-testing was done or not. And this was a very important point, as they said that it was developed and it was self-administered question. Second, regarding the bias and the missing data, like they have used the information from the doctors as well. So the there are different types of biases that could have been addressed, like the recall bias and or the interviewer's bias, and like this. So always identify the biases, and the missing data. Yes, it was not considered. And later on, the limitations were also not mentioned. Whenever you are using a simple prospective study designs, there are several limitations. So it is better to identify those limitations to strengthen your study. And lastly, the comment on the your comment on the unadjusted estimates. So actually, you please kindly study about the adjusted and the unadjusted, because adjustment refers to the reduction of the fluctuation, and actually it meaning that whenever you are doing some your variable is unadjusted whenever there is a bivariate relationship between independent and independent variable, and that does not controls for the covariates or the confounders. So I think and they are adjusted when you add when you consider the relationship of one variable with one or more covariates. So clarify this point as well, and these are all the points from my side. I would like to add other ask other participants to add few more points from their side. Thank you.
Thank you very much, Dr. Amber. Very nice and comprehensive overview. Would Dr. Sadia like to comment on this? Because I want the senior PGRs to comment on the today's presentation. Then we would open this house for our other PGRs. So, Dr. Sadia, please go ahead. Dr. Sadia Rafiq, are you here with us? Okay, now this house is open for all the PGRs, and for the next Saturday, I would like the senior two PGRs to comment first, and then the rest of the PGRs. They are also welcome to please give their comments, suggestions, and feedback on today's presentation. Right. So, all PGRs.
Inshallah, ma'am. Yes, ma'am. Inshallah.
Okay, this time, who wants to say anything? Please raise your hand or give your comment by unmuting yourself. Okay, thank you very much, Dr. Muneeb and Dr. Ambar. And I would really worried that rest of the PGRs, they are not taking active part in their research and also in the critical appraisal of the research, and they are not actively participating in the journal club. So for the next time, I would like each and everyone to be well prepared, and they must take notes of the presentation. And when this article is shared in the group, they should also read it for their own comments, because the professional development is not possible without the critical appraisal and without research. This is the era where the research is the most important part, and the evidence-based medicine and evidence-based practice, they are having the strongest pillar of research. Only those people, those nations, and those students would flourish that would have the strong research capacities. Moreover, there is a very famous wordings that publish or perish. So it is very important that if you don't want to perish, you must get good publications, and also have the habit of reading good articles every week, every day. And the best people would read more than one article in a day. Thank you very much, everyone, and Allah Hafiz.
Thank you, madam.
Allah Hafiz.
Thank you, ma'am. Allah.
Thank you, ma'am.
Thank you, ma'am. Khuda Hafiz.